happens when the frontal lobe is damaged? I'm going to give you 3 words that start with the letter A to help you remember just exactly what might be happening in your patient to identify the behaviors with the location in the brain. It's Tammy with NurseMinder, and don't forget to subscribe and hit that bell button so that you can stay connected as I continue to bring you content. Now, in a previous video, I talked about 3 F's to help you remember the functions of the frontal lobe. So if you haven't watched that video, it's really short, under 2 minutes. Head on over there, watch that first, and then come back. And if you have watched it, you are ready to dive into today. So in the previous video, we talked about function, future, and facial as the 3 F's to remember to help us recall all the things that the frontal lobe can do for us. In today's video, the 3 A's I want to teach you are apathy, apraxia, and aphasia. That's funny that I couldn't remember that one, and you'll know why in a minute. Okay, so we're just going to keep that in the video and keep on rolling. Now, when we look at the functions of the brain, we're going to match that up with the injury to the brain. So let's first talk about function. Function was all those voluntary movements that we talked about in the previous video. And when we lose the ability to function, we lose the ability of our motor ability. Did that even make sense? At any rate, I think I might be having a stroke. Totally kidding. But that's relevant to the frontal lobe. Strokes can cause damage to the frontal lobe. So I'm leaving all the quirkiness in today for you guys, all of it. The first A that I want to teach you is apraxia. Now, apraxia is the loss of the ability to perform or to execute on these learned, very purposeful movements that we were able to do once before, such as tying your shoes. And this is something you will see in a patient who's had a stroke, Alzheimer's, Huntington disease. And so this may be as a result of damage to the frontal lobe. So apraxia. Now the second word is apathy. So when we talked about the function of the frontal lobe being able to express feelings, we go from this to this. There's a change in behavior. And if you think of a stroke patient, they have paralysis that inhibits them from being able to express emotions. So paralysis of those muscles, apathy, it looks like they don't care. There's a change in behavior. And the third word I want to teach you is aphasia. So aphasia is where this is damage to Broca's area. Remember, froze, bro. And it happens to be connected to our ability to speak. And so what will happen is aphasia, there's many different types, but if it's damage to the frontal lobe, you will find that there's hesitations and stutters to answer a question as they formulate those words, but their answers will be sensible. And that's not always the case. So if their answers are nonsensical, they have damage likely to another area of the brain. So Broca's aphasia is where they can articulate a response that makes sense, but it takes a lot of effort for them to get out the word. Okay? So today's video is about 3 words to help you remember what's happening in the brain when it's damaged. First word was apraxia, the loss of voluntary movement. The second word was apathy, not looking like they can express their feelings. And the third word was aphasia, not able to articulate in a clear manner, but sensible. Follow for more.